Setting: gastroenterology clinic. You are a nurse and see patients after they undergo the test at the clinic. You meet John Henry, a 30-year-old man who has been diagnosed with irritable bowel syndrome at the clinic. He is not sure about the condition and its management. Now let's look into the task. First one says, find out the symptoms he experiences. Type, duration, frequency of the pain. Second one says, find out about any triggers he may have noticed like stress or anxiety. Third one says, explain irritable bowel syndrome in simple language. There is no clear cause, but it happens due to an overly sensitive colon or immune system. Smooth muscles become overactive. Symptoms include cramping, abdominal pain, bloating, gas, and diarrhea or constipation or both. Fourth one says, outline treatment options. He has been supplied with medications for pain, diarrhea, and constipation. Fifth one says, importance of dietary changes. Avoid high fiber food and gas producing food like cabbage. Eat regular meals. The last one says, stress management. Suggest yoga, meditation, or gentle exercise. Now let's begin the role play. You can start like, hi, good morning. I'm David, one of the registered nurses working in this gastroenterology clinic. You look so worried. What is bothering you today? Then interlocutor may respond to saying, hi nurse, I've been experiencing severe abdominal problems for the last 6 months. So I just met the doctor to diagnose my condition. Then respond to him saying, I'm really sorry to hear that. Try not to be worried. We are here to support you. So can you please let me know your name and age for verification? Then interlocutor may respond to saying, I'm Henry and I'm 40 years old. Then respond to him saying, hi Mr. Henry, as per your case note, I understand that you've been diagnosed with irritable bowel syndrome. Is that right? Then interlocutor may tell you like, yes nurse, my doctor told me that I have a disease condition called irritable bowel syndrome. However, I don't have any idea about it and its management. Then respond to him saying, do not panic Mr. Henry. This condition can be well managed with certain treatment modalities and we are here to support you. Is it okay with you? Then interlocutor may agree with that. Then continue by saying, okay Mr. Henry, now let me explain you the condition in detail. Firstly, I will explain you what irritable bowel syndrome is and its causes. Then I will explain you how we can manage it. I also have some precautions for you which need to be followed for a couple of weeks to get a better improvement. At the end, you can ask me your concerns and queries regarding it. Is it okay with you Mr. Henry? Then interlocutor may agree with that. Then continue by saying, before proceeding further, I would like to ask you some questions so that I'll get a clear picture about your condition. Is it fine with you Mr. Henry? Then interlocutor may agree with that. Then continue by asking, how long have you been experiencing this condition? Then interlocutor may tell you like, nurse, I've been experiencing this condition for the last 6 months. Then ask him like, what sort of symptoms have you been experiencing? Then interlocutor may respond saying, I have been experiencing lots of issues like abdominal pain, cramping, bloating, gas trouble, constipation or diarrhea or both together. Then ask him, okay Mr. Henry, can you please let me know if you know anything which triggers the symptoms like stress, anxiety or anything else? Then interlocutor may tell you like, I do not know what triggers the symptoms, nurse, but I would like to let you know that I joined a company as a manager almost 6 months ago. It's a highly stressful job indeed. Then respond to him saying, stress is one of the main factors behind this condition. Okay, what kind of diet are you following? Then he may tell you like, I eat all kinds of food which includes both vegetarian and non-vegetarian food. Then tell him like, thank you Mr. Henry for sharing all those details with me. It helped me to understand your condition much better. Basically, this is a common condition among people that affects the digestive system. The exact reason for irritable bowel syndrome is really unknown. It may happen due to overly sensitive colon or immune system. Only a small number of people with irritable bowel syndrome have severe signs and symptoms. It may also happen due to muscle contractions or severe infections in the intestine or stress level. Some people can control their symptoms by modifying their lifestyle. It can also be well managed with medication and counseling. Okay Mr. Henry, I hope you're following me. Then interlocutor may ask you like, okay nurse, how are you going to manage this condition? Then respond to him saying, I understand your anxiety Mr. Henry. I hope the doctor has already prescribed you the medications. Please follow it on time so you'll get a faster recovery. In addition to that, I would also like to give you some more suggestions to overcome the situation. Is it okay with you? Then interlocutor may agree with that. Then continue by saying, first of all, I would strongly recommend you to make some changes in your diet. Kindly avoid high fiber food and gas producing food like cabbages, and also make sure to take meals on time. I can also give you a detailed leaflet which contains the details regarding the dietary modification. Are you following me, Mr. Henry? Then interlocutor may agree with that. Then continue by saying, good to hear that, Mr. Henry. As I told you already, stress also plays a major role in developing the symptoms, so it is highly important to manage your stress level. Therefore, I would also like to recommend you to do some kinds of yoga, meditation and some gentle exercises on a daily basis to manage your stress level. Do you have any concerns or questions, Mr. Henry? Then interlocutor may respond by saying, no, nurse. Thank you very much for your detailed explanation. Then if the interlocutor does not have any more questions or concerns, you can wind up the roleplay by summarizing like, so far we'll be discussing about a condition that is irritable bowel syndrome, its causes and management. I hope you understand that. If you have any more questions or queries, you can contact me at any time. I'll be glad to help you. So once again, I assure you that if you follow these instructions along with medications, you will definitely get a faster recovery. Thank you, Mr. Henry, for your valuable time. I wish you a speedy recovery. Thank you guys. Our roleplay ends here.